afternoon, everybody. Today is Thursday, April the 9th, 2020. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, Dr. Brenda Weiss, Administrator for our Office of Public Health, and Dr. Al Wong, our Regional EMS Director. Since our press briefing yesterday afternoon, we have had 100 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 1,502. 1502. These positive individuals are from 38 municipalities, none of which are reporting their first cases. This keeps us at 59 of our 62 municipalities that are home to individuals with COVID-19. These individuals range in age from 9 to 96 years old. As always, you can see our map, county map at montcopa.org/COVID-19 for the geographic update. The age brackets today are 1 individual between 0 and 9 years old, 2 between 10 and 19, 10 between 20 and 29, 15 between 30 and 39, 18 between 40 and 49, 15 between 50 and 59, 16 between 60 and 69, 8 between 70 and 79, 11 between 80 and 89, and 4 between 90 and 99. There are 54 females, 45 males, and 1 unknown. We do have information that 11 of these individuals are hospitalized, 6 are under observation at home, and 83 we are unsure. I am also saddened to confirm that 6 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 49 deaths. Today there is a 92-year-old female from Upper Gwinnett Township, an 88-year-old male from Lower Marion Township, an 81-year-old female from Cheltenham Township, an 87-year-old male from Abington Township, a 67-yerold male from Norristown Borough, and an 83-year-old male from Springfield Township. 3 of these individuals passed away at a hospital. In terms of racial breakdown, we're going to continue to try to update this daily. We have 5 Asian, 2 Asian Indian, 1 Asian Korean, 4 Black, 24 white, and 13 that is unknown. And just to clarify on that, this data does come from either the self-report of the individual's family or from the death report. If that category was not completed on the death report, there's not necessarily a way for our coroner to get that information. So we may not be able to get complete information on the race of these individuals. I am happy to support that thanks to your good work at staying home, our hospitals continue to have empty beds, both in their regular units and in their intensive care units. This is great news, and we hope that this situation persists. That means whether or not you need a bed for COVID-19, or because you had a stroke, or because you badly broke your leg, right now there is a bed for you. So please continue to stay home to ensure that this remains the case. Update on our long-term care facilities. As a reminder, there are 75 Pennsylvania Department of Health licensed long-term care facilities in Montgomery County. The Office of Public Health and the Office of Senior Services are conducting a coordinated effort to have daily contact with the long-term care facilities in a county to assess the real-time occurrence of COVID-19 in these sites. We now have 51 facilities that are reporting positive cases. There are 38 facilities with 1 to 5 cases, 6 facilities with 6 to 10 cases, 4 facilities with 11 to 15 cases, 2 facilities with 16 to 20 cases, and 2 facilities with 26 to 30 cases. In total, there are 177 cases among residents and 84 cases among staff. Outreach is being done to the hardest impacted facilities in order to help assess their needs and provide guidance based on the CDC and Pennsylvania Department of Health guidelines. I am happy to announce that the Pennsylvania Department of Health has engaged ECRI, ECRI, to provide additional consultation and support for some of the more highly impacted facilities. A couple of updates on our community-based testing site. Again, thank you to the Community Ambulance Association of Ambler, Temple Ambler, Temple University Police, Upper Dublin Township, the Pennsylvania National Guard, and numerous county departments that are assisting with this effort. As of April the 8th, we have tested 4,711 individuals, 4,711. We have 71% of those test results back, and we continue to run 19% positive. So again, this is reassuring that we have not seen a huge spike in the number of people that are testing positive. Unfortunately, the weather today has intervened in a particularly destructive way, and our testing site is now closed. The tents out there literally practically blew away and got ripped. So unfortunately, we are not going to be able to reopen the site for tomorrow. So it is closed and it is done. However, we have good news. Thanks to the leadership of Congresswoman Natalie Dean, who organized a letter signed by Representatives Scanlon, Fitzpatrick, Boyle, and Evans, and with the support of Secretary Levine and the Pennsylvania Emergency Management Agency, the U.S. Department of Health and Human Services and the Federal Emergency Management Agency committed to me on the phone this morning that federal funding for a community-based testing site in Montgomery County will continue through May 30th of this year. I am very grateful and relieved that we will be able to continue to provide this important information to the residents in our region and continue to receive critical data that aids us here at the county in our surge and other planning. We will relocate this drive-through site to the campus of the Montgomery County Community College in Whippane Township. I want to thank the leadership of the college, including board chair, Mr. Frank Custer, and interim president, Dr. Vicki Bestecki-Perez, along with Whippane Supervisors Chair, Michelle Minnick, for their support in allowing us to quickly transition this site. We hope that this will be up and running by next Wednesday. So to repeat, the Temple Ambler site is now closed. It will not be open tomorrow due to extensive storm damage today, but we hope to have the new site at the Montgomery County Community College up and running by next Wednesday, April the 15th. The appointment process will be the same. As soon as we are ready to take appointments, we will make an announcement to let you know. A couple words on social distancing. First of all, I want to thank all of you that had virtual Seders last night. And for those of you that are planning a second Seder tonight, I hope that you are planning to do that virtually. Tomorrow is Good Friday and Sunday is Easter. Please, under no circumstances, should you gather for worship. Please support your church leadership who are doing the right thing and not bringing the community together to celebrate. I just can't stress how important this is. This is not the time to let up. I know how important these holidays are, but by people coming together to worship, we could undo the weeks of hard work that we have all put in, teaching our kids at home, our small businesses and bigger businesses that are closed, enormous personal and economic hardship by people all over this county has been undertaken to get us to the place where we are today, which is actually a pretty good place. Coming together in large gatherings to celebrate either Good Friday or Easter could undo all of that sacrifice that has been undertaken by people in this community. So please, please, please stay home, worship virtually. It's what our community needs. It's the most important thing that you can do right now. And another word on our trails. I just want to remind everyone to please maintain social distance on our trails. If you get to a trailhead and there are no parking spots, don't park on the grass. Leave. Go to a different spot on the trail and see if there's more space there, or come back later. We really do not want to close these trails. We will be out watching this weekend. Our park rangers will be out observing. We will close the trails if we have to. Nobody wants to do that. So please do not crowd the trails. And finally, I want to give a quick update on the Montgomery County Correctional Facility. Since President Judge Del Ricci issued the initial March 12, 2020 order declaring a judicial emergency, the population at the Montgomery County Correctional Facility has gone from 1,342 to 1,086 as of yesterday, a decrease of 256, which is a 19% decrease. I want to reiterate that no inmates at the Montgomery County Correctional Facility have tested positive for COVID-19. And with that, I will turn it over to Commissioner Lawrence.
I'd like to give a business update. Yesterday, we accepted applications for the Montco Strong Small Business Loan Program. As you know, that's a $1 million economic development program from the county. We received overwhelming response to that. We had 1,520 applicants who applied for $33.7 million worth of grants. And we had at least one application from each of our 62 municipalities here in Montgomery County. So clearly with $1 million, a lot of people, a lot of businesses are going to be disappointed. We will be getting back to you. The applications are being reviewed now for eligibility, and we are reviewing other ways that we can help our small businesses here in Montgomery County during this pandemic. I'm going to share a little bit of information now about other ways that you can either help businesses or businesses can receive resources. We do have our Montco Strong Small Business Gift Card Network, and you can find that at www.montcopa.org/COVID-19. Look under Find Your Topic and select Business. Businesses can register their gift cards there, or if you'd like to purchase a gift card, you can do that. Also on our COVID Hub site, we have a regional business survey where our Commerce Department is gathering information from businesses to see what types of resources you need. During that, if you're a business and you have not filled out that survey, we would encourage you to go to the Hub website to do that. The PA Career Links Montgomery County physical location remains closed, but workforce development services are available for Montgomery County employers. These services can be accessed by contacting the PA Career Link at 610-270-3429. And they still are providing recruitment assistance for businesses that need to hire additional staff at this time. We also have 2 small business development centers here in Montgomery County. Temple University, Go Temple, and Lehigh University. Montgomery County businesses may seek support from either, although they are recommended to work with the one geographically closest to them. These centers have been mobilized to provide specific support for businesses seeking technical assistance for state and federal funding related to COVID-19. This includes regular webinars, some pre-recorded, and other direct guidance. The Small Business Development Centers are funded by the state and federal government, and you can access the Temple Small Business Development Center at www.fox.temple.edu or Lehigh University at sbdc.lehigh.edu. And we want to remind everyone again of a partnership with DVIRC, www.dvirc.org. They've developed an online supply portal using the Basecamp project management system to connect manufacturers to opportunities to supply regional needs for PPE and other critical equipment. Interested manufacturers can be directly connected to DVIRC by the Commerce Department if they are interested in being a part of the supplier network. And with that, I'll turn it over to Commissioner Gale.
Hello everyone, I'm Montgomery County Commissioner Joe Gale. Earlier this week, I had the opportunity to participate on a phone conference with President Trump and many county commissioners and mayors from all across the nation. And after that call, it's very clear that there's a unified effort to overcome this crisis, and it's truly remarkable to see the teamwork from all levels of government and the continuing of our community-based testing site, and the state, Southeastern delegation in Congress stepping up to support us is an example of that. The response to this pandemic is federally supported, state managed, and locally executed. And with that, I would like to provide an update on Pennsylvania's Unemployment Compensation Office. I realize that filing for unemployment compensation is a major concern for many of our residents. The Pennsylvania Department of Labor and Industry said it has processed about half of the 1 million unemployment claims it has received since mid-March, when this pandemic was kicking into a higher gear. The Unemployment Compensation Office is adding new staff, transferring workers from other departments, and bringing back retired workers to help fulfill all the heavy demands. In addition, some of the typical unemployment rules have been temporarily suspended to make it easier to file for benefits. For example, claimants are not required to prove they have applied or searched for new jobs and to maintain their benefits. Claimants are also not required to register with PA CareerLink, which is our job opportunity and career resource center. Previously, eligible claimants would not receive compensation for the first week of unemployment. Now, eligible claimants may receive benefits for the first week they are unemployed. At this time, benefits are not being extended beyond 26 weeks. Eligible applicants who file for unemployment compensation will receive 2 letters and a 4-digit PIN number. Your PIN number will arrive in the mail as well. If approved, your first benefit payment should arrive within 4 weeks of filing. It is also recommended that you continue filing your biweekly claim even while waiting for approval. For specific questions about your unemployment claims, you can email uchelp@pa.gov. Again, that email address is uchelp@pa.gov. You have to include your full name and the last 4 digits of your Social Security when you use that email address when you're seeking assistance for unemployment claims and need help with those resources. And with that, I'll turn it back to Commissioner Arbush.
All right, happy to take questions.
Why move the testing site? Why not keep it at Temple Ambler?
Well, this Upper Dublin Township has been wonderful, and as has Temple Ambler. I think it's just time for us to kind of get out of their neighborhood, and that's one reason, although they've been incredibly wonderful hosts. And we also wanted to move the testing site a little more into the center of the county, a little further west, so it's a little more easily accessible for more people toward the western part of the county.
If I may, Commissioner Gale, you talked about a unified front here in your conversation with President Trump. It doesn't appear that we're unified. Every state is doing its own thing. Every state has different restrictions. In New Jersey, they're telling grocery store workers to wear masks, and they're shutting down parks, and some states are shutting down borders. Delaware, everybody's doing something different. Can you explain to me what this unified front is?
Sure. The question was, I mentioned there appears to be, in my opinion, a unified front to combat this pandemic and help the citizens all across our nation. And it was asked that it doesn't appear to always be unified in certain circumstances. I believe that the federal government should provide guidance. The state government ultimately has to make the decisions that impact their state and the citizens that they represent. And then down to the local level, when it comes to county government and local governments, we have to execute those decisions. So every state is different. Pennsylvania is different than New York, which is different than New Jersey, which is different than Arkansas. So each governor should do what they think is right to help the citizens that they represent. And the federal government's there to provide resources, guidance, and ultimately it's up to the local government. All our staff here in Montgomery County is working tirelessly to address the needs of the citizens of Montgomery County that are impacted by this virus.
Can you rehash the significance of the statistical data you're getting from the community-based testing site, how that's helping you?
Sure. The question is if I can discuss how the data that we're getting from the community-based testing site is helping us. So at this point, we've tested over 4,700 people. So that's a pretty good number of folks to give us an assessment of the positivity rate here in Montgomery County. And the good news for us is that we started out 5 weeks ago running about 12 to 13% positive. As expected, that positivity rate has increased. Now we're staying right around 19. Some days I think we've been 20, maybe one day at 21, but we're staying right around 19%, which is encouraging for us because it tells us that we're not seeing just an enormous spike of patients testing positive for the coronavirus. That does two things. One, it helps us estimate what our surge capacity might ultimately look like and whether we'll have enough beds here in the county. And two, it lets me say to all these wonderful people listening that their staying home is actually making a difference. If people were not following social distancing strictly, I would expect to see that positivity rate just marching upwards over time. And happily, although we've seen it come up some, which we fully expected, we're not seeing the huge spikes like they've seen in New York and places like that. So while I'm not going to say that it's over, it's definitely not over. I will say the curve appears to be flattening, and that data helps us be able to say that.
You said yesterday, you mentioned that maybe we're approaching the plateau. Can you say that with any kind of,
not yet. The question was, are we at the plateau or approaching the plateau? I think we're on our way to the plateau, but I won't really know that we were there until we're on our way back down again. So I know everybody wants to know, when is this going to be over? I think Governor Wolf today signaled appropriately that schools should not go back into session this year, because I think that we are truly looking at probably the middle to the end of May before we can take substantial steps to start to unwind this. It's just going to take some time. But when we're actually at the peak, I don't know, but right now things look pretty good for us. I'm cautiously optimistic, but people have to stay home. As I said earlier, this could very easily be undone by large groups gathering this weekend or anything along that line. So people need to stay home.
How much is that affected by what happens in other states, though, particularly surrounding states? Because if we hit the end of this in Pennsylvania, but New Jersey doesn't, you still have people coming and going, and you still have the spread.
So the question was, how does what's happening in other states impact us here? So I can tell you at the very local level, not so much here in Montgomery County, but our Philadelphia hospitals are seeing patients from both New York and New Jersey coming to their hospitals because the hospitals in New York in particular are quite full. So we are seeing some of that happening. We all know that pandemics are not partisan and they don't care about borders. And so it is going to take a collective effort regionally to completely unwind this. I've been so pleased that here in southeastern Pennsylvania, our elected officials, we talk every single day, 7 days of the week. We've been working in very close collaboration across the 5 counties here in the southeast. So our goal with that work is that at least here in the southeast, we will be able to take some collective action as we start to unwind this on the other side of this. What that looks like, I don't think any of us know yet.
I was actually going to ask that. Is there any way to kind of foresee how you do unwind this?
Not that I am able to talk about today. I mean, there's ideas kicking around that are related to mass testing and things like that, but there's nothing concrete.
Deanna touched on masks. Do you think a mandate of masks is helpful, or do you think that is?
I think that, as I've said many times, that cloth masks provide modest protection. It's not zero, it's modest. And as long as people don't think that the mask enables them to leave their house and go back to doing whatever they were doing before this all started, it absolutely will provide some modest protection, but isn't magical and shouldn't be considered a license to go out and hang out with your friends or play basketball or take a walk right next to your neighbor. Modest protection.
What about in places like grocery stores where you have people behind a deli counter cutting your meat or handling food? And especially now, the grocery stores and some of the big box stores have those set hours where it's just elderly that can come in. So one employee without a mask, could that potentially infect people? Should those employees be required to wear masks?
Well, those employees should be having their temperatures taken. They should be having, they should be assessed every day for whether or not they have symptoms. They should be wearing gloves, and I have no problem at all with them wearing masks if the store is able to obtain those masks. But again, it's modest protection. So those other things are more important, making sure they don't have a temperature, making sure they have no symptoms, making sure that they're wearing gloves. And if they are coughing or sneezing, they shouldn't be at work. We do, as we've discussed, know that people can be asymptomatic and be contagious, but it's not, there's not a lot of evidence that if you are slicing deli meat, packaging it, it's going home into a refrigerator, that the virus can be transmitted that way. I'm not saying it's impossible. There's not a lot of evidence that that is a major route of spread. Certainly if things are being cooked, if the virus were there, that would be.
Right, but there's still so much we don't know about.
Right, right. So again, masks offer modest protection. Depends on the type of mask that it is. If they put those workers in N95 masks, that would be a lot of protection. So it really depends upon what the store can get and what they're able to do. But the temperature monitoring, the symptom monitoring, and wearing gloves and making sure those people aren't touching their faces and sneezing and coughing are really the most important things. Okay, great. See you tomorrow.